Nursing. Today's topic is all about early ambulation after surgery.
For entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. The learning objectives we will be discussing in this video will be benefits of early ambulation after surgery, potential complications of prolonged immobility after surgery, steps for progressive ambulation after surgery. Let's get into the topic. Early ambulation after surgery involves the practice of mobilizing or getting patients up and moving around and is a crucial aspect of patient care aimed at promoting faster recovery and reducing the risk of post-operative complications. Benefits of early ambulation after surgery includes prevention of post-operative complications, example, deep vein thrombosis, pulmonary embolism, pneumonia, urinary retention, pressure ulcers, and muscle weakness. Next is stimulating circulation and enhancing blood flow throughout the body. Next, it improves gastrointestinal, genitourinary, musculoskeletal, and respiratory functions. It also relieves pain. Early ambulation boosts the client's outlook and fosters a sense of independence. It decreases the length of hospital stay. Next, potential complications of prolonged immobility after surgery. Commonly, deep vein thrombosis and pulmonary embolism. Prolonged immobility predisposes patients to venous stasis and blood clot formation in the lower extremities, which can dislodge and travel to the lungs, causing pulmonary embolism. Early ambulation promotes blood flow, prevents venous stasis, and reduces the risk of deep vein thrombosis and pulmonary embolism. Next is atelectasis and pneumonia. Immobility can impair lung expansion and clearance of pulmonary secretions, leading to atelectasis, that is, collapse of lung tissues, and pneumonia. Early ambulation encourages deep breathing, coughing, and effective clearance of respiratory secretions, reducing the risk of pulmonary complications. Next is muscle weakness and deconditioning. Prolonged bed rest can lead to muscle atrophy, weakness, and functional decline. Early ambulation preserves muscle mass, strength, and endurance, preventing deconditioning and promoting faster recovery of mobility and functional independence. Next is pressure ulcers. Immobility increases the risk of pressure ulcers due to prolonged pressure on bony prominences. Early ambulation reduces pressure on vulnerable areas, promotes circulation to the skin, and prevents the development of pressure ulcers. Now comes steps for progressive ambulation after surgery. First step is assessment of patient readiness. Assess the patient's vital signs, pain level, level of consciousness, surgical site, tubes and drains, and overall condition, whether all the parameters are normal. Next step is bed mobility. Encourage active range of motion exercises for the extremities such as foot pumps, leg lifts, and turning while the patient is in bed to prevent stiffness and muscle atrophy. Next is sitting on edge of bed, that is dangling. Help the patient sit up on the edge of the bed, allowing their legs to hang down. Dangling encourages blood flow from the lower extremities back to the heart. This helps prevent venous stasis, a condition where blood pools in the legs, increasing the risk of blood clots, that is, deep vein thrombosis. Next step, preventing orthostatic hypotension. Orthostatic hypotension is a drop in blood pressure that can occur when a person moves from lying down to sitting or standing. Dangling helps the body gradually adjust to an upright position, reducing the risk of a sudden drop in blood pressure and associated symptoms like dizziness or fainting. Provide support to ensure safety and balance. Next step is standing. Assist client to standing position, that is transitioning from sitting to standing. Support the patient as they bear weight on their legs and feet. Assess client's balance and any signs of distress or weakness. Ask the client to walk in place. Next comes supported ambulation. If support required, guide the patient as they take steps with assistance using a walker or other mobility aids as needed. Provide physical support to prevent falls. Next is walking. Assist client to ambulate. Start with a short distance. Maintain grip on the gait belt. Have a wheelchair or seat available if needed. Gradually increase the duration and intensity of walking sessions based on the patient's tolerance and progress. Next, monitoring and documentation. Continuously assess the patient's vital signs, pain level, and overall condition after ambulation. In case if the patient finds difficulty in ambulation, ask the patient to sit on the bed and reassess the condition and resume the procedure after some time. Document the patient's ambulation progress, including the distance walked, level of assistance required. So far we have discussed benefits of early ambulation after surgery, potential complications of prolonged immobility after surgery, steps for progressive ambulation after surgery. So here you go with early ambulation after surgery. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.